Hello my friends, I am Dr. Firuza Parekh and I am the director of the Well Women Center at the Reliance Foundation Hospital. Today we are going to talk on a very important topic, fertility preservation for women. Let's first look at some facts. Do you know that a woman is born with 500,000 to 1 million eggs? Now you'll think that that's a large number. It looks like an infinite amount of eggs. So why should women worry about their fertility? Strangely, men continue to produce sperm throughout their lives. You know the famous example of Charlie Chaplin, who had a baby when he was 80 years old. But with women, it's a different story. Women have a definitive number of eggs, and believe it, they start getting depleted from the time that they are born. Every month, a woman loses 11,000 eggs even before she touches puberty. By the time of puberty, the number of eggs are between 300,000 to 500,000. A woman is most fertile before the ages of 24 to 34, and she will have about 120,000 eggs at the age of 32. By the time she is 37, this drops to 25,000. Now, by the time a woman reaches menopause, she has less than 1,000 eggs left. So, by the age of 42 to 43, she doesn't have more than about 1,000 eggs. That is why this lecture is important to guide you about preserving your fertility when you are young. There are many ways that a woman can protect and preserve her fertility. Today, we are seeing many young women who do not plan to have a baby soon for many reasons. They may be tied up with their careers, or they do not feel settled enough to plan a baby. Many are not considering getting married for a while, and some women even want to be single parents. Now, whatever the reason, women should note that their fertility starts falling after the age of 34. Let me share with you some of the ways that you can preserve and protect your fertility. If you are single and don't have a partner, you can easily consider freezing your eggs. Let's look at some of the statistics if you are considering freezing your eggs. To have a 70% chance of live birth, a woman between the ages of 30 to 34 needs to freeze 14 eggs. At the age of 35 to 37, she needs to freeze 15 eggs or more. And at 38 years to 40 years, she needs to freeze at least 25 eggs. So please remember, unless you freeze an adequate number of eggs, your chances to have a baby reduce. I always tell women who come to me for egg freezing to ensure that they have at least frozen 15 to 20 eggs. That means that you may have to do more than one cycle of egg freezing for it to translate into a baby later on. Women who have polycystic ovaries have an advantage because they may succeed with only one cycle, as they may produce a lot of eggs. I remember recently a young girl with PCOS who I treated produced 35 eggs in one go. However, if you are married or you have a partner, you should not opt for egg freezing but consider embryo freezing, as we don't have the need to thaw the eggs again in order to fertilize them with your partner's sperm later. Let's go one step further and look at the latest technology of fertility preservation, that is called ovarian cortex freezing. At our Well Women Center, we have established a state-of-the-art laboratory which is a first of its kind in India to freeze ovarian tissue. Now you may ask, why should we choose this method as compared to egg freezing? Let me explain. In ovarian cortex freezing, we carry out a laparoscopy and remove a tiny slice of the outer layer of the ovary. Now this tiny tissue, which is microscopic, will have thousands of immature eggs. In the laboratory, our embryologists will gently scrape out the outer layer of the ovary which is known as the cortex, and cut this tissue into many tiny fragments which are then carefully frozen by the advanced technique of slow freezing. These will remain suspended in the frozen state in liquid nitrogen at minus 180 degrees centigrade. When you are ready to conceive, the laparoscopic surgeon will take some of this tissue, some bits of this tissue, and implant it back into your ovary, where it will start functioning like a normal ovary in a few months. The advantage of this method is that you have a good chance of ovulating naturally and conceiving on your own, even without doing IVF. However, it is also possible to undergo IVF and harvest your eggs at that time from the thousands of eggs that have been saved and are now activated after retransplanting that small amount of ovarian tissue. The other advantage is this method will also prevent you from reaching menopause early. Today in India, we are seeing many young women undergoing premature menopause at an early age, even before 40. Now this method can salvage the eggs and postpone menopause. Such are the wonderful miracles of science. We at the Well Women Center of the Reliance Foundation Hospital have many state-of-the-art facilities for fertility preservation for you. Our team will guide you safely through this procedure.